Over the past 10 years, California has made great strides in increasing access to health care, where our uninsured population has dropped by nearly half. However, although we have made tremendous strides in increasing access to health care, many continue to forego needed medical treatment because of the continued year-by-year increases in health care costs. Health care has become far too expensive, and if it continues, will become unsustainable, not just for those without insurance, but also for those with it. Not only does it impact the state's ability to fund important priorities such as education and transportation, it is having a significant impact on the ability of California businesses to afford and offer health care benefits to their employees. In fact, over the past 10 years, state budget expenditures on health care have increased by 8% year over year the past 10 years. And California's businesses have increasingly foregone offering their employees health care insurance, where only 55% of California companies have reported providing health care insurance to employees in 2016, which is down from 69% in 2000. Most importantly, we're seeing people make serious and potentially debilitating health decisions due to the cost of health care. In a recent report by the University of Chicago, it was found that 40% of Americans skipped a recommended medical test or treatment due to cost. What all this information demonstrates is that the current trajectory of healthcare costs is unsustainable. If it continues to go unaddressed, inequitable access to care will worsen. Healthcare disparities will increase, and the disproportionate use of medical care between those who can and cannot afford their health care will expand. This is why I have authored AB 3087, the Healthcare Price Relief Act, which will establish an independent healthcare cost, quality, and equity commission to set reasonable base amounts hospitals, doctors, and other providers of healthcare service can collect from payers. The 11-member commission would build off of Medicare rates, not lower than 100%, to determine provider base amounts and adjust Medicare Advantage rates to establish a capitated amount that health plans must use as a basis for premiums. By building upon existing models, we can establish a transparent process by which increases in healthcare costs can be kept reasonable, continue to expand access to care, and provide our healthcare industry with the ability to receive a fair return on investment. In doing so, we can help address the long-term sustainability of our healthcare system by addressing unreasonable and egregious rates while maintaining access to quality care for all. I wanted to also address some of the questions we have regularly heard about the bill, because I believe it will help to clarify where certain elements have gotten lost in translation or where misinformation has added to the confusion about the bill. A frequent concern that has been raised is that this bill would lead to rationing of care and cause physicians to flee the state and hospitals to close their doors. This is not true. Rather, AB 3087 would counter what we are already seeing in our healthcare system today, the rationing of healthcare by the people who need it the most. Due to the cost of care, many are regularly choosing to forego a needed medical treatment in order to pay the rent, put food on the table, or pay their utility bill. This bill would ensure that rates are reflective of the need to maintain and expand access to not just quality medical care, but affordable medical care. Regarding physicians and hospitals, we are already experiencing a shortage of primary care physicians who are on the front line of our healthcare system and watching as hospitals consolidate and shutter healthcare facilities in the process. As opposed to our current reality of self-rationed healthcare due to cost, AB 3087 would ensure that provider rates are tied to improving health outcomes and reducing health disparities. Further, AB 3087 also takes into account what is needed to recruit and retain a qualified healthcare workforce, and that there is a fair and reasonable return on investment for providers. Another concern we have heard is that this bill does nothing to address inadequate Medi-Cal rates, which are a driver of cost shifting between commercial and Medi-Cal rates. Although there is significant research that demonstrates that cost shifting from a more conservative viewpoint has occurred, but usually at a relatively low rate, the bill does include language taking into account the number of Medi-Cal patients providers serve, the fiscal impact associated, and make adjustments to the rate as necessary. Lastly, a concern we have heard regularly of this bill is a veiled attempt to implement Medicare for all, or to keep rates at or near Medicare amounts. This is untrue and is an argument that I believe is misleading and a misrepresentation of efforts my office made to help stakeholders read through the bill language. Specifically, in one of the documents we used to help stakeholders understand the different provisions, we included an example of how the Medicare rate can be used to determine provider rates. For example, it read that rates could be 125%, 150% of Medicare, or higher. However, some misrepresented this effort to state that the bill would set rates at 125% of Medicare and would result in an estimated $18 billion in lost revenue for the over 400 hospitals in California, and that payment reductions will lead to an estimated 175,000 healthcare workers losing their job. That's a hypothetical that's not based in fact, and it's incorrect and misleading. Rather, as many of you know, Medicare rates are often used by physicians, hospitals, and insurers to negotiate their contract rates. It is used as the foundation upon which physicians, medical groups, hospitals, clinics, healthcare plans, and insurers negotiate their rates. This is the same approach used for AB 3087, one that does not set a provider rate ceiling, just the opposite. It sets a floor using existing Medicare rates. I'm not looking to go back and set rates where they were 20 years ago. This is a prospective bill whereby the Commission will be looking at today and going into the future. The notion that this is only going to lead to cuts in current rates is simply not true, as the Commission is required to set rates at fair market value and foster a more equitable healthcare system for all Californians. Simply put, Chair and members, the status quo is unacceptable. And if we maintain this, the way the system is currently set up, we're going to see more Californians, more small businesses not be able to afford health care. And frankly, for the providers, the hospitals, the doctors going into the future, they need and deserve a sustainable system too. And so this bill seeks to ensure that everyone can come to the table and provide input to ensure that the rates that are set are ones that are fair to everyone, but that don't have these unexpected increases that really make it an unsustainable system for all.